Hello, namaste.
Namaste. So today we wanted to interview you with basic questions. We want to know about your university. So could you please say a few words about your university?
Okay, so our university is very famous in Russia. I think it's now very famous all over the world and especially in India. If it comes to ranking, we are number 8 among medical universities in Russia, according to 2022 ranking of RAIX. We also included in Time Higher Education ranking, and due to some political things, some international rankings are postponed. So, but anyway, we same as maybe a little bit less than universities from big cities like Moscow and St. Petersburg. But if it comes to price of tuition, cost of living and quality of education, I think we have it as a very good position and very beneficial position for students from India and from our countries. If it comes for internationalization, we have more than 3,100 international students, more than 12,000 local, and international students are represented from 57 countries. Indian students are represented very good in our university. We have very good diaspora, Indian diaspora. It's about 1,000 students from India, very big. What are our best features? First, talented, extremely motivated and extremely good staff, faculty. And our aim is to establish a system, educational system, which can give opportunity for any student to open and find out all the big things which is hidden in the personality and become a very good doctor. We have nice simulation based center and we have early clinical exposure. From first year students are going to clinics and starting from basic care and improving to advanced care. Second one, we have high-tech medical technology in Russia. For example, a robotic surgery center. In Russia we have 12. One of them is in our city and belongs to our university. Even we have 2 robots, surgical robots, Da Vinci. And a third one, we have a system of controlling or helping and supporting students, and parents could be absolutely calm that the children are under strict supervision. Sometimes students are not happy with this because we controlling them to avoid them from any mistakes like drinking, smoking, misbehaving, etc. Sometimes they saying, oh my God, it's a prison. It's not prison, it's a system which will build a good personality from a student who sent far away from the home and from parental control. And students are doing crazy things outside of parent control. That's why this system is also important and why parents and students choosing us. High quality of education, the ratio between tuition, the cost and quality, and the system of controlling and supporting students. That is the core reason for choosing us, if to be brief.
Very nice. So since how long do you have international students in your university?
From Soviet era we had about 50 students annually. From 2016 we have dramatic rise of numbers. When I got this position we had 300 students, if I'm not mistaken. Currently we have 3,100.
And how many students do you have from India?
1,000. 1,009 to be precise.
Yeah. How is your experience with Indian students?
We have 57 countries, and I don't want to say this country is better or that country is worse, But India is our strategic partner, and the Indian students and the Indian culture is very diverse, and we are very interested to work with Indian students, and the Indian students are also happy in our city because we have a lot of local people who are interested in Indian culture, and we have a lot of contests, festivals of Indian culture. Some Russian students and Russian local people are interested in Indian food, Indian culture, so Indian students feel very comfortable here. Our republic is multinational, which is a good feature if you compare, for example, Moscow, etc. Historically, Bashkortostan is multicultural place, so it's the best place, same as India is multicultural. Bashkortostan is also multicultural.
And I've seen that your campus is located in one of the, it's really posh, it's really clean, and is the university, the location of this university, is it one of the best places in Africa?
Yes, we're located in downtown and the campus, the main campus, but the hospitals located all over the city, so sometimes students are not happy if they choose this hostel or they're happy with this hostel, so after second year it have no sense.
So I've seen your hostels, they're really nice. So may I know how many hostels do you have for international students?
Six hostels right now. We will open a new one, 7th in July or June, and another one we will open in November or October this year.
That's nice. And so since I know that you're also a physician, you're a critical care physician,
Yeah.
I understand it's a really tough job and a busy job. So
Yeah.
could you please, since you're in the job, so could you please explain about the hospitals affiliated to you, I mean your university hospitals. Can you please tell me how many hospitals you have and what are the opportunities you gave to the international students?
Yeah, we have a lot of opportunities if it comes to clinical exposure. We have our own hospital, 725 beds, with robotic surgery center, with angiographic up-to-date operation room. And we have around 20 students, 20 hospitals in Ufa, where we have departments, surgical departments, internal medicine, obstetric departments, which also belongs to university. And in our republic, another 50 hospitals could be used as departments, the basis for students training in summer, when we send students for summer practice, because Ufa is a big city, but number of students 12,000. So we send students also to our Republican hospitals also.
That's very nice.
More than 50.
So how about your affiliation? Like, do you have international affiliations, like with, international
Yes.
cooperation with other countries?
Yes, of course, more than 48 countries. Our main partners, the core partners, are European countries and China, but I would not talk about European countries today. But anyway, our colleagues in Germany, in Austria, they even in this situation, they are still our friends. We have the contacts, scientific contacts, and second important partner is Chinese universities, Harbin, Beijing, Sichuan, and our cities. And we are starting to establish a partnership with Indian universities as well. We have some good experience with companies who are doing so-called MCI coaching, if I'm not mistaken, FMG coaching. And usually these companies have their own hospitals, so we started from this. Also we have some cooperation with small hospitals, and we are sending students for summer practice from 2018.
Very nice.
I mean, we were sending big numbers. We were sending students before, big numbers like 300, 400 students for summer practice. And we expect to send to your hospital in upcoming year also.
That's nice. Thank you so much. So can you please tell me about Ufa? I really found people very friendly in this city. and
Yeah.
the city is very clean. I mean, before I came, I didn't really know that the city is really big. It's really big. It's nice. People are really friendly. Can you please tell me what is population in Ufa, and can you please tell me something about this city?
So Ufa is a nice city located in the middle between Asian and European part of Russia, that gives opportunity to feel real multiculturalism. So Asian and European roots are intercommunicated here, so we have more than 50 nations represented in our republic. As if it comes to city, Ufa have more than 1 million and 100, I think, inhabitants here. So it's the capital of our republic. Our republic is well known as the oil industry, chemical industry, as well as very famous natural resorts.
So how about the food in Ufa?
Food is diverse, interesting: Russian, European, Asian food, Tatar, Bashkir food, as well as Asian food, including Indian food, represented here, and from any pocket.
Wow. How about your curriculum? Like, you know, do you because there is a myth. I mean, there is a confusion in Indian students that students have to study only the Russian language in first year.
No.
So can you please tell me how is it?
For Indians, for representative of countries who insist on English as a medium of instructions, we offer English medium programs, but Russian also included in the curriculum. As we just discussed a few minutes before, if you go to hospital, Russian patient 100% will not speak English with you. So these things which published in Indian Gazette sometimes it seems like very futuristic. If we want to establish education, medical education in Russia, in our 700-bed hospital, okay, send us enough English-speaking patients. After that, we can establish 100% English medical education. Before this, as in any other countries, for example, Jordan, if we send in students to Russia or China, these students must study in Chinese or Russian, respectfully. So after 4th year, students have lectures and practical discussion in English, but the clinical exposure with patients, of course, in Russian. But it's basic Russian.
Right.
Same as you speak with vendors, with taxi drivers, etc. But with a deeper level of understanding, because you must get history from patient, complaints from patient, and if you given physical examination, you also have some conversation with patient to understand what actually these things, communication things is half of your success in diagnosis.
So how about these examinations, like, you know, the medical and the pre-medical, all these, like, you know, we have the 19 subjects where the students have to go through, you know, during the clinical course. Do you also have the similar 19 subjects like we discussed? Like,
we have 65 subjects, and this essential 19 subjects required by Indian government, they are included. But
so
we have extra.
Right. Yeah. So yeah.
Even the duration of MBBS, it's technically it's MD course,
right,
not
yeah.
MBBS, not 5 years.
Which is equivalent to MD.
Yeah. And this additional internship year, which incorporated to this curricula. So the number of internship hours during these 6 years exceeds 1 year and 2 months.
Wow.
If you count the number.
So do you all these students, like, you know, who get into their clinicals, like during their hospitals, all these, do they get an opportunity to attend the patients, like, because the students have a confusion, and there are universities across the globe who don't, the students don't get an opportunity during, you know, in the hospitals. And so can you please tell me, like, how do you organize these clinicals for the students once they get into, you know, their, you know, after in their third year or after second year? How do you organize?
So, for example, my typical day, I take, I'm working in ICU, so I take my students to, for example, this precise patient. So students are present with me. I'm explaining this patient in English to him. If a patient is conscious, students have opportunity to talk with him in Russian, of course. If sometimes patients are able to speak English, but in most cases we talk in Russian. So after that we go to our study room and we see his medical card. Unfortunately, medical card is in Russian. So that's why some fluency in Russian is also required. Anyway, the teacher, in my case it's me, will discuss the lab tests, the instrumental examination in English if students have some problem with interpreting.
Right.
So that is the meaning of mixed language. Sometimes applicants misunderstand this, like we throw them to a person who doesn't speak zero English, he cannot speak English, and students something like this. No, and but this is not enough. This is not enough. These classes is not enough. When I was a student, 3 times per week I was spending a night shift. Same is in United States. You probably know about shadowing, as the students are like a shadow behind the professor. So the student will be efficient if he do all these things, but he could be only efficient if he is a bit fluent in Russian.
So I mean, I've seen you have a lot of international students from different countries. Like, so it's not really easy for every university to train the doctors or professors, because like working in hospitals is one thing and training the students is another thing. So how do you plan?
It's mutually beneficial.
Yeah.
So when we had less amount of international students, our language skills were also not very good. So when we decided to grow up and increase our level of internationalization, we opened a lot of doors for ourselves. So if we want to buy Da Vinci robotic surgical system, okay, which place we have to go for training? Okay, to United States, to European Union. Okay, which language we have to use in European Union or United? English. While I'm dealing with Indian students, with Arabic students in English, I will improve my skills. So this internationalization is beneficial for both.
So you also train these professors and teachers?
Yes, we have language courses. Annually 80 to 90 of our teachers are having language courses. Moreover, we have 20 top-level international professors with high ranking in QS, ARWU and our rankings incorporated to our teaching staff, to our faculty. Also, we hire our alumni, our former students, for teaching if they have good marks and if they are successful in clinical settings. So during all these years we established very successful system.
Very nice. So, and do you have any, like, in the future, as we discussed, like, are you going to have any scholarships or any plans like for the international?
Yes, we have these plans. First of all, students who finish our language courses will get a discount.
Wow.
We're planning to establish it. Students who have high NEET scores for Indians, for Arabic our system, for our countries our system. Students who have good results in our Olympiads, which we conduct in our university. All these students will have some discounts in tuition fees. This year we plan to establish this system.
Yeah, and thank you so much for considering the proposal to learn the Russian language, since Russia and India have a very good relationship, and we had a plan to have this Russian language program before? Because once you finish your 12th and your NEET examination, I mean, what do you think about this program? Like we discussed about, having, this Russian language thing before they come to Russia to start the medicine.
Yes, we will try to start in late July or the beginning of August and finish before MBBS will start in October, in late October. So during this few months, students will be able to get some basics in Russian. After they arriving to Russia, they will be fully prepared for living. We will be not facing problems like how to buy SIM card, how to buy bread, how to buy milk, etc.
That's really interesting. That's really it's a very good opportunity.
As well as discount.
Yeah, and it is really a very good opportunity that you can get your place, because since Bashkir State Medical University is one of the top universities, you can get your place. You can get your place reserved. You can get your discount, and it will be really easy for you once you come to Russia, because you'll also already learning this language, so you'll have to use this opportunity. So do you have any message for the Indian students who will be coming in 2022 academic year?
So guys, we are inviting you to our university, the best university in Russia. We can guarantee you will get high level knowledge and you will be satisfied with the quality of education, with tuition fees, and with the city and with the environment, and with your friends who are waiting for you here. So get admission to Bashkir State Medical University. We are waiting for you. Join our team.